Hi everyone. So let's learn something about suture needles. So I have prepared a separate presentation on this because suture needles are very important, since if you are not selecting the proper needle size, needle length and the type of the needle, whether it is a round body or a reverse cutting needle, then it will be very difficult for you to actually practice suturing. And there will be problems of needle bending, there will be problems of needle breaking in between the sutures, and needle tearing the tissues. So you have to be very careful while selecting your needle, because needle is the thing that is actually piercing the tissues and starting the suturing process. So just a little bit of the theory also, and finally the practical part. And of course there are a lot of videos about needles that I have made about how to hold the needle and how to pierce it through the tissues. But let's learn a little bit of the theory of the needles also, so that when you buy the needles you should know, okay, since this is a round body, these are the various places where I can use the round body. Okay, so let's see what are the ideal properties of a needle. So it is the high quality needle should be there. It should not be very big needle. It should be very sharp. It should not be dull at all. Because if we are buying very cheap sutures, or some people use reusable needles, they sterilize it again and again, they become dull over a period of time. Please do not do that. Buy pre-sterile sutures and use them. This is very good for a practice. You can charge patient a 200-300 bucks extra, but do not re-sterile, or do not you use the needles again and again. And it should be able to give minimal trauma to the tissues, not much, because if you are using very big needle in suppose oral cavity, it is going to give lot of big needle hole, and bigger the hole is, bigger the more is the healing time. And it should be well stable in needle holder, and it should be sterile and corrosion resistant. So if you see any signs of corrosion on the needle, please discard it immediately. That is the needle which is not to be used. So I have made a simple diagram describing the needle. This is the area where the thread goes. It can be swaged needle, which I will explain in the upcoming slides, or it can be eyed needle. Sometimes there is a small eye over here, and like the needle that we use in the household sewing techniques, that there is an eye and we put the thread and we knot it. And then there is a swaged needle. That means the thread is already swaged, means punched, or maybe fixed to the body of the, or this point of the needle. And this is the needle which is most commonly used, swaged one. And these are the various theoretical part of the needle cord length, needle radius, needle body, and everything. And a needle point, this is very important. Needle point has to be very sharp, then only it will pierce the keratinized mucosa effectively. So whenever there is hard tissue that we are stitching, we need needles which are pointed and which are cutting in nature. The tissues which are soft and friable, like muscle tissue, like very soft subcutaneous tissues, we need round body needles, which are the needles which are non-cutting in nature. And because when we are piercing the needles through the muscular tissues, the muscle fibers are very friable, they're very soft, and if you are using the cutting needles, the needles will tear through the muscle fibers. Then in those cases we'll be needing the round body needles, so that the needle goes through the tissues very, very smoothly. So mostly in oral cavity we use cutting needles. So what is needle eye? Again, I have told you that this is the needle and there is a small eye over here. So we put the thread in, we knot it. And there are swaged needles also, and these are atraumatic needles, totally atraumatic needles. And in this case, the needle and the suture thread, they are one in nature. Okay, and these are the most commonly used ones. So these are the photographs of the eyed and the swaged needle. You can clearly see an eye over here, and you can see we put the thread, we make the knot, and we do the suturing. This is still used in a lot of practices, and people do the take the needle, put the thread, and then sterile it. I usually do not prefer it. Yes, for the sake of the videos, I have used this needle in most of the cases, but that is only for the demo purposes. Please do not use these needles and these kind of thread materials in your actual practice. So this is the swaged needles that we use most commonly. You can easily see that this is the body of the needle, and this part of the thread is swaged, means connected to the needle, and the thread is one. Needle body and the thread, they are one. There is no eye here. Okay. So what is the body and the shaft area? So this is the body. This is the body of the needle. So the cross section, it can be the triangular cross section or the flattened side cross section. It can be curved needle. I'll show you in a picture. It can be 1/4 circle needle. It can be 1/2 circle needle. It can be 3/8 circle. It can be 5/8 circle. Mostly we use 3/8 circle in dentistry, and or we can use the half circle also. Half circle I prefer using it for round body. 3/8 circle I prefer using it for the cutting needles, reverse cutting needles. And again, it is your choice. For the suturing the oral cavity, where I am dealing with lot of keratinized mucosa, definitely the needle of the choice will be 3/8 circle with the reverse cutting. So the needle point is either cutting, round, or blunt. Blunt needles are not commonly used in oral cavity. Cutting or round body needles are mainly used in mouth. Then the cutting edges. So this is the edge of the needle. So it can be conventional, it can be reverse cutting, it can be taper cut, and this can be taper and blunt. Just go through with these presentation or go through with these slides once, and your theory part will be clear. So reverse cutting 3/8 needle is the most commonly used needle in the oral cavity, and it is mainly used for the suturing of the keratinized mucosa. So as we all know that oral cavity is full of keratinized mucosa. It is not a very soft mucosa. So for example, if we are dealing with the skin tissues, palatal mucosa, buccal alveolar mucosa, so these kind of needle, reverse cutting needles, are most commonly used. That means we are using the 3/8 needle and the reverse cutting needle. Reverse cutting needle looks something like this. If you see this picture clearly, the upper part of this needle is actually flat, and this goes in some kind of a triangle from below. So this is the cross section of the needle. So when it enters into the tissues, because of this cross section, it enters and pierces through the tissues, and without cutting through the tissues and without damaging the tissues, it comes out. So reverse cutting needle, which is the most commonly used needle in the oral cavity. Okay, 3/8 or 1/2 circle needles are also used, and round body needles are also used in case of the muscles, fascia, and very friable oral cavity mucosa. Suppose there is infection in the mouth, and there is lot of dehiscence of gingiva, lot of infection is there, lot of pus is there. In that case, the gingiva becomes very friable, very easy to tear. In those cases, I prefer using round body needles, because this is the body of the needle, round. So the tip is still cutting, but the body is round. So in that case, if I am piercing it through the muscles or the soft friable gum tissue, it is not going to cut through my gum tissue, and whenever I am putting forces for the placement of the knots. So in those cases, I'll be using the round body. Whether I want to use 3/8 circle or a 1/2 circle, it is absolutely my choice. Or you will see what kind of needle are you okay with. But if you are a beginner, you can start with 3/8 circle needle, because that is the most commonly used. Okay, so let's see what are the different guidelines that we can use when we are using the needles. There will be some repetition of these principles when I'll discuss the suturing principles with you, but since the needle is the main component which is going through the tissues and actually initiating the suturing process, the suture principles are actually overlapping. So these are the things which we need to see when we are using the needles. So force should be applied in the direction that follows the curvature of the needle. Means, I'll just draw a picture here. So this is the curvature of the needle. Okay, so if we are, and this is the tissue, we will not enter the tissue like this. We will enter, see, this is the cross section of the tissue. Okay, so we will not enter the tissues like this. We will enter along the curvature of the needle and we will pull it through the curvature of the needle. We are not going to, suppose if the needle tip is here, we are not taking it out like this. We are going it according to the curvature of the needle so that it slides or glides through the tissues very smoothly. Suturing should always be from the movable to non-movable tissues. See, suppose you are doing a flap surgery. So this is the flap. And this is the flap you have done. This is the releasing incision. And this flap is now, this is a full thickness flap. And flap is now off the bone, and this is the movable tissue. This flap is now movable and the other side, which is the lingual side, is fixed. So from the movable side to the fixed side you will move. You will not move from the lingual side to the flap side. Okay. Avoid excessive tissue bites with small needles because it will be difficult to retrieve them. Suppose if this is the incision line, if you are taking too much big bite, so needle point will be here, the whole of the needle will be embedded in the tissue itself. So it will be very difficult for you to grab this needle point and take it out. So in most of the cases 2 to 3 mm of the bite is more than enough. So do not take bites more than that. Okay, so if you are having a very large needle, which usually we do not prefer in the oral cavity, then you can take bigger bites. But 2 to 3 mm of the bite is more than sufficient. Use only sharp needles. This is very important. Do not reuse the needles. Do not sterilize them. And sharp needles, sometimes if you have given sutures in one area, like suppose if you are given sutures in third quadrant maybe, and you have done with the suturing and you start with the fourth quadrant, sometimes the same needle gets dull. So change it immediately, because dull needle is going to injure your tissues a lot and this will hamper the healing of the wound also. Do not hold the swaged area with the help of the needle holder. So you are holding the needle with needle holder, and this is the swaged area that we're talking about. We are going to hold the needle from here, not from the swaged area, otherwise it will damage the swaged area and the thread will be separated. Needle should always penetrate the tissues at right angles. Never force the needles through the tissues. Means if this is the tissue and this is the incision line, needles are not entering like this. Needles are entering like this. This is the needle, this is how it is entering and this is how it is coming out. So penetrate the tissues at the right angle. Avoid retreating the needle from the tissues by its tip. This will damage and dull the tip. Attempt to grasp the body as back as possible. So if this is the incision point, cut point or incision point, so this is the, you are not going to grab it from here, otherwise it will damage it. Let it come out slightly till here and then you grab it as back as possible. So usually what I do, if this is the needle and I'm grasping it from here, let the whole needle pass through the tissues and let it be out, and then you grasp the needle with the help of either the needle holder or the tooth tissue forceps, and then take it out along the curvature of the needle. And again, I have already told you that adequate tissue bite means this is the incision line. It should not be this much, and it should not be this less. If you are taking too big a bite, what will happen? The needle will remain in the tissue itself, and it will be very difficult to take out the needle, and it will be you might break the needle. The needle will become dull. And if you are taking very small bites, then if you are taking out needle from this area, you might tear this part of the gingiva or the tissue. So at least 2 to 3 mm of the bite is required, so that the needle should pass out of the tissues very beautifully and without damaging or without tearing through the tissues. This is how a needle, the swaged end looks like. This is how a thread looks like. This is how a needle looks like. So go and open up a suture packing and see what kind of needle is there in your practice and study that needle. So if suppose an infected case comes to you and you are doing the extraction and you need to give sutures, you know that you need to use what kind of needle. You need to use round body needle, spaced needle, of course pre-sterile. And if it is a regular thing, then you can use the reverse cutting needle. And whether you want to use the 3/8 needle or the 1/2 needle, that is absolutely your choice. My personal preference is most of the time is the reverse cutting and the 3/8 circle needle. So this is everything about needles. Let's jump on to the next section and about the suturing principles, what things we need to take care while we are putting the sutures in the oral cavity.